So I just want to quickly talk a little bit about evidence-based interventions, which kind of sets up, I think, the discussion a little bit for Paul to talk about REAIM. So we'll talk through this relatively quickly, but please, at any point, if anybody has questions, please stop me. It really is an overview of what evidence-based interventions are. So 3 things I want to do with this is, 1, define the key terms that are related to evidence-based interventions, discuss the different evidence-based options or approaches, and then those benefits and challenges that might be associated with those, with using evidence-based interventions. So when you hear the term evidence-based, just type in the chat for me what you think when you hear that word or that term. Paul here said intervention, okay. Previously tested, research tested, good. Science, research, good. All right. Sorry, I'm having a hard time advancing my slides here. Okay, so I felt that if we're going to talk about evidence-based research, we should just break down the terms. So we start with breaking down what is evidence, and simply put, it is just the available body of facts or information that's indicating whether a belief is true or valid. And so just a little background about it is that we want to make sure that we are doing things that have a body of information to support what is true or what is valid. There we go, sorry.
Easy for you to say.
So if we think about evidence, particularly in public health, the different types of evidence that we think about is related to personal experiences, things that would be word of mouth. Those are different types of evidence that we can have, as well as program evaluation, intervention research studies, and systematic reviews. So typically in public health, and I know some of you may not be in public health, so I'll just share this with you from my experience, that we make decisions that are really based on different types of evidence. And it usually will span the spectrum relating to subjective evidence, such as personal experiences or direct experiences from folks, to research-based evidence. And that would be those things where we have controlled conditions, which may not actually be something we could do in a real world setting, but nonetheless, it helps us to gather evidence. So when we're planning and implementing programs, we typically incorporate evidence from those different sources, whether it be subjective. So like I said, personal experience is one of those examples, or if it's from objective sources. So doing more things like intervention research studies, systematic reviews, that type of thing. Do you all have examples of different types of experiences or evidence in each of these elements that anybody would want to share? So for instance, is there any personal experience examples that you would want to share related to evidence? Or even word of mouth? Any of the ones you want to pick would be fine.
No, I just printed off today because when I get them, AHRQ, the Agency for Healthcare Research and Quality, does comparative effectiveness reviews, and they came out with one today on a living systematic review on cannabis and other plant-based treatments for chronic pain.
Nice.
So I have their scientific opinion based on a review of multiple studies about the effectiveness of cannabis on pain.
Very nice. So that's a prime example of systematic review of those different interventions. Great. Okay, so those are just some examples of the different types of evidence that we could use. And then there's also, if we think about evidence, we also think about it in terms of research and practice. And I know some of you in here are in the clinical realm and not necessarily the research. So if you think about it, evidence can be derived from research, which would be those interventions that I talked about earlier that you package up and want to disseminate. And these are created after they've been proven to be effective in a controlled trial. So randomized controlled trials is what you typically hear about. And those types of research-based evidence is more generalizable and can be recommended from different systematic reviews of multiple studies or even policy analysis. And with regards to practice-based, this is also available as packaged intervention programs or as more general recommendations based on what you're learning by actually doing the practice. And if any of the practice-based folks in here want to add to that, please feel free. But really, it's just having that you do get to have evidence from the practice realm, but then there's also evidence that informs what we do from the research realm.
And I think when I think about evidence derived from practice, I also think about kind of the tacit knowledge that people in practice get, that it's that sticky knowledge that's tough to kind of articulate and share, but can be learned through shadowing and other types of approaches. And then I also think about evidence from practice related to Dave, and I think maybe Kate's discussion points before about who actually does it, who pays for it, what's the decision-making infrastructure to get an evidence-based intervention actually into practice. Mm-hmm. So I think there's those side of things too that often don't come from the research world, or not definitely, but most often don't come from systematic reviews.
Yeah. Okay, and then ultimately, what is an evidence-based intervention? And very simply put, it's treatment or an intervention that we know is effective, and we know it's effective because we've implemented the procedure faithfully. And what we mean when we say faithfully is we're speaking about the fidelity of the intervention. Did you implement it as it was directed or as it was prescribed? And was it put in place in a way that it should have been? So that, in a nutshell, is what an evidence-based intervention. That's how we define what that would be. Okay, so I wanted to talk just a little bit about when we think about the different factors that would affect evidence-based interventions. And so we examine these different types of approaches that we select from different programs or different research or whatever your topic area of interest may be. And you might want to consider an intervention at a different level, or consider the different levels that an intervention could affect. And so the social ecological model really helps to serve as a framework for planning or thinking about interventions, especially evidence-based interventions. Particularly because it states that health is affected by a variety of different factors, from individual characteristics to attitudes of friends or behaviors of your peers, and even policy and environment can be a factor. And also thinking about different strategies or public health approaches that you could include in your activities related to the intervention that would help to produce change at those different levels within that model. So thinking about the individuals, like I said, thinking about the environments, and then the policy. So the social ecological model really allows us to think through how an intervention can really not just work in one area or one sector, but it really can affect multiple factors or multiple levels that we would want to consider. So for my visual learners, this is just basically what I had on the previous slide. I'm putting it into a visual format for you to think about on this slide, where we're thinking about how that individual health of a person, starting in that very inner circle, is influenced by all of these different factors that are outside of that individual in the other outer rings. So the intervention in terms of evidence-based intervention is needed or can be at every level of the socio-ecological model. And even going to the outer level of public policy, there is also opportunities for public policy as well as organizational policy to help change or alter environment for individuals or groups. So an example would be when we have nutrition standards or when smoking cessation happened across our country, starting in California, and how that the policy around that just became very effective and was adopted by different states across the country. And then also thinking through the interventions that can directly target behavior of small groups of peoples or different social networks. So for instance, if you want to implement like a self-management program for cancer survivorship, or I know Ms. Kate and I talked about hypertension and diabetes in last week when we did our breakout sessions. So having interventions that could directly target smaller groups or social networks, maybe not necessarily at the larger or outer rungs of the social ecological model. So different levels of interventions can have an impact across communities, especially with regards to an individual at the interpersonal, organizational, or community or policy level. So I want to shift quickly here to talk a little bit about the different types of evidence-based approaches that can be used. And so there's 3 categories that we'll just briefly touch on tonight, excuse me, which is the packaged programs, policies, and strategies. And the policies will kind of just touch on both at the public policy and the organizational policy levels. And then strategies will focus on what Ms. Kate mentioned earlier, one of her examples with regards to systematic reviews. And I just want to highlight these 3 because they may be useful in helping you to kind of determine or find and adapt and evaluate any evidence-based interventions you might be interested in the future or in your current work. So for the first category is packaged programs, and these are interventions that include instructions and have like specific materials that are needed to implement it with success. So literally they have like a manual that tells you step by step how to implement this said intervention. And on this slide, I give 3 examples of different evidence-based programs that are actually available and packaged in a way that can be disseminated. So the first on the far left of the screen is the Breast Cancer Education Intervention, also known as BCI. And I pulled actually all of these from the what's called Evidence-Based Cancer Control Program website. And on that website, you literally can go there. If you just Google it, it'll take you to the website, and you can search a number of different evidence-based interventions that you could use based on different population. Like it breaks it down by population, by health need or health issue, by a number of different categories. So you can search in there for, let's say if you're looking for a breast cancer intervention or a cancer intervention or diabetes, you can search in there and it'll give you a list of all of the diabetes evidence-based interventions and all of the manuals and all of the materials that are related to it. So definitely a useful website for those of you that are interested in that. Thank you, Paul, for sharing.
Just so folks know, that one includes the one that you're talking about, Kiana, but it also has, I think we have like 18 or 19 different repositories of evidence-based interventions.
Yeah.
So if you click that link, we've got the links summarized there.
Awesome. Thanks. So you can definitely find these 3 examples at the link that Paul did share. But this first one is the Breast Cancer Education Intervention. And this one was just designed to enhance the quality of life for breast cancer survivors. And as I mentioned, it has materials that's a whole manual that is devoted to how you would implement that. Another example is the Body and Soul, which is a church-based healthy eating program. That's also available on that website. And then lastly is Fit and Strong, which is a physical activity program for middle-aged and or older adults. They have 2 different manuals that are available, where if you wanted to focus on a younger population or middle age, I think it was 40 to 50, 55, they have a different manual versus if you worked with 65 and up, because it would be different targets in terms of what you would do, activities you would do with them. Have any of you used or familiar with any of these programs by any chance? Just curious. Nope. Okay. I'm good. I'm introducing you to something new. I do want to just mention before I move on to the next slide that all these products are produced from research studies that were conducted in controlled conditions. So what that basically means is that they recruited people to participate. They participated in the programs, and how the programs were implemented were assessed, and then they evaluated the data that came from that to make sure that the program was actually creating the change or the outcomes, and not some other factors that weren't accounted for. So all of these programs, again, that's why they are considered evidence-based. And then there's policies that I mentioned before, and this is just a basic definition of what policies are with regards to systems for laws and regulatory measures. But as I mentioned, public policies set at the national, state, or local levels is one example of an evidence-based approach. So for instance, public policy for smoking, there's ordinances you can't smoke in places, that would be an evidence-based, and that's based on evidence from what research was conducted to determine when you don't allow smoking to happen, what type of health outcomes come from that. So that's one example in terms of public policy, but there's also organizational policies or rules that can be developed. And so examples of those would be worksite health plans, or what types of healthy foods options are offered at the worksite. I know specifically at the College of Public Health, in our vending machines, like there are only healthy options that are offered. Well, healthy, I will say. I think they could be a little healthier, but nonetheless, there are policies about what types of food can be offered in the vending machines for the students, as well as faculty and staff that want to access it too. And then next and lastly, for the approaches of the evidence-based strategies. And this is a broad recommendation that are based on systematic reviews of multiple studies. And the studies have been proven effective through research. And so what really basically happens is it's just a compilation of all of these studies into one review, for the ease of just trying to make sure that we can summarize what is effective and what works. So the first example is the task force. Let's see if there it goes. The Task Force for Community Preventive Services. This is a group, or it's a group that conducts systematic reviews for studies on adolescent health, asthma, diabetes, a number of different things. And they provide recommendations that are published in what's called the Community Guide. And I don't know how many of you have heard of that before, but the Community Guide is an excellent resource for any of you that do work within either public health or the health field, and trying to make sure that you are well abreast on the different recommendations for those areas of health issues. And then there's also the U.S. Preventive Service Task Force, and that particular group disseminates clinical recommendations that are derived from some systematic reviews. So this may be helpful more for the clinicians that are here, that are looking to figure out what evidence-based approaches are useful in that type of setting. And then lastly is the Cochrane Collaborative, and this is mostly for an international audience. And this collaborative conducts systematic reviews that actually range from both clinical and public health topics, where evidence is typically, like I said, it's the evidence to date really hasn't been necessarily clear on that particular topic. And so the Cochrane Collaborative tries to provide some of the clarification in that. So these are just a few of different places that you can get systematic reviews to kind of understand some of the evidence-based interventions that are out there related to different topics, different settings, just to help you make decisions about what interventions are appropriate and important for the work that you may be doing. So let me look at my time here, see what we got. So just a couple questions I wanted to ask each of you or all of you. Thinking about what I shared and some of what your experiences are with using evidence-based interventions, what do you foresee as challenges in using these types of interventions?
Well, I think even what we're seeing currently is that, we understand vaccines and the evidence behind them and the work there, but sometimes you run into public opinion, cultural decisions, different things like that, that you have to work through in your evidence-based approach.
Yeah.
One of the things that I found in my practice, I'm sorry, did I?
No, go ahead.
Was this sort of the concept of prioritizing. So I certainly know the U.S. Preventive Services Task Force guidelines and recommendations regarding, let's say, women's health and all those kind of things. But when I have patients who are uninsured and multiple chronic health problems and have transportation issues, et cetera, then sometimes I'm focusing on, what I can control. And, maybe we can get the mammogram van to come, but then they have to schedule it and they have to show up. And so sometimes, and one of the things I learned over the years of working with very vulnerable populations is it's hard to be held to the same standard.
Yeah. Yeah, I think that speaks to a couple of the comments in the chat about it's not always a good fit. It's not a one size fits all type of situation for a lot of, like you said, a lot of the populations that may have different needs than what those interventions were designed for. Dave, did you want to mention?
Yeah, I was just going to say that we have to figure out how the system is going to work, that if we put all the burden on the provider, it won't happen to any great extent. And so how can we support them? And how can we, whether we use local health departments, whether we use other community-based organizations, but we have to have a system that works. You just can't say, well, we're going to do this and this. And what I found is that a lot of community-based organizations, including local health departments, have such a low volume that it really doesn't do much good. So we've got to figure out how to address that.
Yeah, that is definitely a big challenge, I think, with regards to these types of interventions.
Another thing, and that you talk about the health departments, Dave, is it's getting better with things like NEHI and stuff like that. But or charts and stuff don't talk to each other. And so, that's getting better all the time. But it is a problem with knowing who's, what's been done and what's available. And that's a huge issue.
Yeah, we got to figure out how to share data. There's no doubt about it. I'm less optimistic about NEHI, but the potential is there. But man, we did a single request for data by local health department district, and it will take almost a year to get the information. So it could be done better, I know, and quicker, but data sharing is really an important aspect of this. It's got to flow both ways, from the clinic to the community-based organization and back.
Yeah, I would agree with that. Oh, Paul, you're on mute.
I was just asking Naresh if it was making his ears burn or her ears burn. I'm sorry, I don't know who Naresh is. Oh, maybe he's still on mute. But I think isn't Sync Health the?
Yeah, that's NEHI. Yeah. I wondered that same thing. Naresh, are you working on Dave's report?
Well, this is Melody. Yeah, I understand it. Yeah, sometimes things take a whole lot longer in the data world than we expect. I also work at Sync Health with Naresh, so.
Oh, great.
But yeah, it's a challenge, but things are getting better. Like you say, the data systems are getting better. And so, yeah, we can get better. There's always opportunity to do that, Dave. We understand.
Yeah, no, the potential is there. I don't mean to imply that I'm not optimistic, but we're a long ways away from really sharing data on anywhere close to a real-time basis.
Yeah. Yeah. And I mean, like,
At least in some areas,
Mhm.
And it's tough because many providers and others don't like to share data.
Yeah.
So,
But I had a situation a couple of years ago where I was at a clinic that I just volunteer at. And this is an example of how it can work and be amazing. And the patient came in and was working with students and didn't really speak English very well. And we didn't have the right interpreter. And I've seen this really bizarre history about whether or not she had HIV and all this kind of stuff. And I went into her Epic record and we share data with CHI. And I'll be darned if I couldn't go in and find all the notes from her encounters that she was coming in to talk to us about. And I'm going, okay, this is how it could work.
Mhm.
It was so helpful.
Yeah. I know that some of my partnerships with Charles Drew, we talked a lot about kind of the sharing of data with their electronic health records and how it's not the same as the other their other partners. For instance, I think they were talking about CHI in this conversation we were having. So there was a struggle with us trying to understand what type of behavior health records did we have for one of the projects we were doing, and we just couldn't get around it. And it was just kind of one of those moments that we were kind of like, well, we need some type of way to share data in a way that it's not in a chart that is in somebody's file folder that hasn't been entered into an electronic health record for whatever reason. I guess behavioral health is a little bit different than medical health records. But
I'll just also put in a plug for Unite Nebraska, where they're trying to collect data on social determinants and other things, and that has tremendous potential.
yeah,
So I'm optimistic about that, but trying to convince some of these rural clinics to do this has been challenging, unless things have changed, Melanie, in the last 3 or 4 months.
No, David, it is a challenge. But it's kind of starting over a little bit. Everybody focused so much on COVID for so long and still are. But that opportunity in that social space actually came, became something that helped drive it a little bit. Maybe didn't make that broad sweep of social determinants that we wanted to, but certainly found people finding value in connecting to how to get people connected to get CARES Act money, to get housing relief and food relief and things like that. So kind of a mixed bag, but it's slowly but steady making its way. And I think you're right. It's hard to get people to share that data, but it's certainly part of every person's clinical story, a part of who they are and what they need. So,
yeah, agreed.
Yep.
Agreed. Overall, I'm optimistic, but we have some challenges to overcome yet.
yeah. So we kind of started addressing the second question already with how we could address some of these challenges. Did anybody want to add to that response? And like I said, I know we talked about some of the things, but if there was anything burning that anybody else wanted to add to that before we moved on. Okay.
I'm going to jump in because, and I don't remember whether it was Unite Nebraska. I thought it was SynCalc that came to North Omaha Community Care Council. I do think that the other thing is to engage the community.
Mm-hmm.
And so here we are talking about community engagement. How do you get the community engaged? It's not just the providers and the clinic sharing data, but the patients being willing to share data.
Yeah.
and seeing the value of that. I know there's some national efforts. We've got that one thing going. I can't remember the name of it, Dr. King, but you know, it's a challenge, and I tried to enroll in it, and it was a lot of work.
Oh, all of us.
All of us, yeah.
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 Well, the group that came and talked to you was Sync Health, and underneath Sync Health is the HIE platform, as you knew at Old Knee-High, to look up those records. There's also Unite Nebraska, which is a social determinants arm. So
Okay.
all of those kind of rolled up, and the PDMP as well, all kind of under that one umbrella.
Yeah, that's what I thought. Yeah, thank you.
You got it.
All right. Well, I don't want to steal Paul's thunder here, so I'm going to wrap up for us tonight on the evidence-based piece. But just as a summary of the things we discussed tonight, there are different types of evidence-based approaches that we can use. Like I said, for instance, there's packaged programs and policies that we can think about. And then, of course, different strategies that can be used in order for us to implement these evidence-based approaches to reach our outcomes. And the purpose of really implementing these approaches is really to increase our likelihood of success and making sure that we're able to achieve the outcomes we really want to achieve. And then also it saves time and resources. Instead of you having to build a new program, excuse me, from scratch, you have at your fingertips some resources that we shared with you related to where you can go to find these evidence-based approaches. And like I said, save that time and resource instead of doing it from scratch. All right, that is all I have. Are there any other questions or comments before we move on to talk about RE-AIM? All right.